Let us read from the Wikipedia the definition of guidelines. In Wikipedia, you will find this phrase: a medical guideline, also called a clinical guideline, standard treatment guideline, or clinical practice guideline, is a document with the aim of guiding decisions and criteria regarding diagnosis, management, and treatment in specific areas of healthcare. So guidelines have different names. Be aware of that. You may see medical guideline, clinical practice guideline, and they're used for developing, guiding decisions regarding diagnosis, management, or treatment. Modern medical guidelines are based on an examination of current evidence with the paradigm of evidence-based medicine. And coming to this, I need to refer to this evidence-based EBM pyramid, evidence-based pyramid. Please remember that in the evidence pyramid, we had in the top of unfiltered information, we have the unfiltered information. On the top of that, we have the randomized controlled trials, the experimental studies, followed by cohort studies. This is very important, that these are on the top of the unfiltered information. However, we may further improve our evidence, and there we come to the filtered information, and in the filtered information we have the critically appraised individual articles, the guidelines, and finally systematic reviews. Okay, so that was for explaining you where in the hierarchy of evidence we have the guidelines. It is near to the top of the evidence. One billboard picture to let you think about the evidence or guidelines. You see, please just have a look and stop the video maybe and think about it. What is the purpose of this ad, and how you would react when you see this as a citizen walking in your city, and on the billboards you see the big picture saying that which would you rather prefer, a cholesterol test or a final exam. Final exam is the examination after death, of course. So this billboard ad was criticized a lot. It was published in Canada and in some other countries. It was developed and funded by a drug company producing cholesterol medications, anti-cholesterol medications. And of course, if this regular citizens see this, they are expected to go for a cholesterol check, and if it is high, there will be prescriptions of anti-cholesterol, cholesterol-lowering medications. So there is a problem, of course, isn't it? When you see this, and everybody, every adult, or even children, maybe they will request, hey, I have seen in a billboard ad, we should check our cholesterol, so please, my GP, my doctor, order a test for me. And that would lead to harms, isn't it? Harm to the individual, also harms regarding economically or increasing the burden of the healthcare personnel. So there should be obviously some rules and regulations who is going to undergo the cholesterol test, among the healthy people, of course. That's why we have the guidelines. That picture I wanted to show you to make it more clear why we need the guidelines. And the guidelines, there are different levels of systematic development in the guidelines. So even the guidelines themselves, they're graded from S1, the recommendations by groups of experts, which is easier to prepare, of course, and faster to develop. And then we have the best guidelines, which are called the S3, evidence and consensus-based guidelines, which have the evidence, which take care of the presence of the evidence, but they are also involving the expert consensus. So 4 different types of guidelines, actually S2 consensus and S2 evidence-based. So it could be also said that we have 3 different types of guidelines regarding the level of systematic development, of course. Okay. Another break here.